Well, there's advantages on both sides. The Canadian advantage, of course, is that it's free to all Canadian citizens. If you live in Canada, you have free health care. The disadvantage is that we often have very, very long waits to access that health care, longer than we want to, especially if it's an urgent situation like a cancer or a heart problem. The American system has its advantages in that there is no wait, but it costs money. So there are advantages and disadvantages, like I say, to both systems. I needed a knee replacement. I went to my family doctor and he sent me to an orthopedic surgeon, for which I waited a year and a half just for the appointment, with my knee steadily getting more and more painful so that I wasn't able to sleep at night. I lived in a 3-story house. Going up and down stairs was agony. I was having to put my life on hold. When I got in to see the orthopedic surgeon, he put me on the waiting list for a knee replacement a year and a half hence. And then there's a 6-month recovery period. So we're talking about like 3.5 to 4 years before you're through this ordeal. I didn't want this ordeal to go on and on and on. I wanted it to be over. I wanted to be on the road to recovery. I wanted to be able to live my life again without pain and do the things I love to do. I like to go to the cottage and hike. I like to play with my grandchildren. I like to swim. I couldn't do very much at all, and it was getting steadily worse and more painful all the time. I was sick of being on strong painkillers, being knocked out by them half the time. Enough is enough. Well, it's tourism in a way, in that you're definitely out of your own surroundings. You're in a new environment. Medical, of course, that speaks for itself. And that's, I guess, the only way you could make any sense of it. It is an oxymoron, of course. You don't go for vacation on this medical tourism. You go for a medical intervention. I think that it's just outrageous. I don't think that Canadian citizens should have to suffer and wait on long wait lists and put their lives on hold and not be able to enjoy their life because the powers that be are putting us as inconsequential, seemingly. Instead of patients are supposed to be patient. They have to be patients in Canada. And that's the whole issue. We have to be patients. And it's not always easy to be patient. And doctors can be, not just the receptionists, but doctors themselves can be very, very arrogant because they have all the business that they could possibly want. They have long waiting lists. You're not number one to them. And I have encountered some arrogance on the part of doctors. I have encountered some very, very compassionate doctors, on the other hand, and I have encountered some that were very arrogant. So it's really hard to say which is more, but there are often, in a specialist office, for sure, there are very long waits in the office just to get in, and you have to go with the idea that you're going to spend the afternoon. Well, we really don't have a choice here. If you want to see the doctor, you've got to wait your turn. And when I go in the office, I might have an appointment for 1:30 and not get seen until 3:30, or I might get seen at 1:45 if I'm lucky. I go in the office and I look around. I see how full the waiting room is, and I count how many people are ahead of me, and then I count as each one comes in and out to see how many more. And sometimes I go up to the desk and say, "Can you tell me how much longer? Can you tell me how many people are in front of me now?" That gives me a little bit of an idea how long I'll have to wait. How convenient is it for me to get to? Oh, I got an appointment set up with the specialist, with the orthopedic specialist. I saw him within a month, and I had my surgery 6 weeks later. So it was very convenient time-wise. Very convenient time-wise. The only obstacle being, of course, that it costs money. And a lot of Canadians are forced to stay on the wait list because they can't afford to pay for the American care. No, I think, like I said, both systems have their pros and cons, and somewhere in the middle, somewhere there's a solution. But Canada hasn't got it, and the States hasn't got it. They've both got their problems, and they both have to be worked out. I don't know what the solution is. I'm sure there is one, but I'm not smart enough to figure it out.